My name is John Ferguson. I'm the Chief Medical Officer at Austin Health, and I've been here now for just on 7 years. One of the things that's always been a passion, I think, for us and for myself is the health of our Aboriginal community. What many people may not know is that before European settlement, the health of the Aboriginal community was actually better than that of the European community. And with the settlement of white men came a lot of diseases and a lot of other issues that have since created a gap between the health of our Aboriginal community and of our non-Aboriginal community. In 2005, the Commission for Social Justice did a review of this with the intent being how can we gain equality of health for all of our population. In 2008, this was taken up by the federal government under the program called Closing the Gap, and that program set a target of health equality for our Aboriginal community over 25 years. Now, since that time, that gap has closed, but there are still major differences and discrepancies in the health of our Aboriginal community and that of our non-Aboriginal community, particularly in areas like cardiovascular disease, renal disease, paediatrics, mental health, dental health, and a raft of other processes that underpin all this. What's happened at a Victorian level is the government has a program called Kulin Ballot, and that translates to healthy people. And that recognises that health is not an isolated aspect. It sits within a context of a full community response, and that involves the social determinants of health, such as education, accommodation, employment, family strength, social feeling of commitment, and incomes. At Austin Health, we have our program called Narrajara, and that means, or translates as healing in the local language. What I would encourage all our staff to do is to liaise with and engage with our Aboriginal liaison officer and the full team to ensure that we can guarantee equity of access, equity of treatment, and equity of outcomes for our Aboriginal community.
I'm Paula Jeffs. I'm the Executive Director of Human Resources here at Austin Health. At Austin Health, we recognise that economic disadvantage is linked to poor health outcomes, and economic disadvantage is often brought about by joblessness or unemployment. So by creating employment opportunities for Aboriginal people, not only will we be able to help improve health outcomes for them, but to be able to create a diverse workforce that reflects the patient mix that we treat. We've created an Aboriginal employment plan in response to the Victorian Government's Karita Yurumboy initiative, and that is really about generating employment opportunities for Aboriginal people. And we've already started that, and we've created opportunities for Aboriginal traineeships, internships for medical officers, graduate nurse positions, and also we're trying very hard to create a welcoming environment for Aboriginal people to apply for our vacancies. Attracting Aboriginal people to work with us is only one part of the plan. We also need to make it an excellent place for them to work. So that means making it a safe and respectful environment. And that starts with understanding cultural norms and best ways of communicating and showing that respect. The aim is to provide a respectful place for Aboriginal people to come and be treated, and a safe and inclusive place for Aboriginal people to work.